All right. We shall jump in 2 minutes after the hour. So we can see our results. I love that 29% of our respondents are collaboration experts. 3% are participating, but think they could improve. That's probably my camp. And more, a hefty percentage are new and want more information. Thankfully, nobody is not in them anymore, like dropping out of them, but we do have a couple that have not participated in collaboratives at this point. So hopefully everyone will find something they can take to their day-to-day work out of this great conversation. As we think about these kind of seismic shifts in the healthcare market space and how they affect how health systems and health departments and community partners work together to advance community health. I am very fortunate to have two wonderful colleagues and peers in the community health space. So Stephanie Stokes, she's the community health and children's health manager for Intermountain Health, and then Angie Gribble, senior director of community health and engagement at St. Luke's Health in Idaho and Eastern Washington. So thank you both for being here. This is going to be a really exciting conversation. I'm Will Snyder. I'm the co-founder and CEO of Metopio. And with that, we will jump in. If you have questions, as you can see, you can add them into the chat or ask along the way, and we will definitely reserve a couple of minutes at the end to answer any other questions that might come up. So with that, what we'll cover today is kind of the idea of this, I think, pretty exceptional collaborative that emerged in Idaho over the last few years. 16 organizations in particular, how they built a shared data infrastructure, the strategy that went into place. They are wrapping up a very large collaborative community health needs assessment, and then really how they move to that outcome-driven action, both internally and also with community partners. So, when we were thinking about titling this webinar, we were like, I think Stephanie actually said in the planning meeting, there's just so many market forces right now that are forcing us to act and think differently. And we were like, that's a great way to frame this. Never ending in healthcare, there are mergers and acquisitions. But really, I think the last two are the incredible externalities that are pushing health systems and their community partners to think differently in a very rapid and meaningful way. And one is changes to the Medicaid program that passed through Congress last year through HB1. And then also, as kind of a result of HB1, a renewed focus on the sustainability of rural health, rural hospitals in particular, with the Rural Health Transformation Program. And so the Rural Health Transformation Program is an allocation of federal dollars to the states. Each state can choose how they deploy those dollars, but really it's focused on sustaining rural access. And a big part of that is understanding what the needs are of communities, rural communities. So, all of this is pushing and pulling in ways that are really accelerating the work of collaboratives. Just a refresher for those of you not familiar with Metopio, we are the data infrastructure to support collaboratives, to support population assessments, as well as community health improvement plans and data dissemination. So we've built a very flexible data model that can help you collect, organize, and analyze data. We have been very methodical and thoughtful about how we use AI in the platform, but it is there as an assistant to really help move you through your work faster and provide greater depth of analysis. And then ultimately, when we were kind of building out some of our community health needs assessment modules, we heard over and over in user focus groups that nobody likes to write the report. So it was great to have AI kind of do the first draft. I think people like editing. They like kind of figuring out what the narrative is with the data, but that 0 to 1, that first step to get those 50 or 100 pages in process, AI is a great assistant. And then also supporting the subsequent implementation plans. So with that, I will be quiet because Angie and Stephanie have much more interesting content to cover as the on-the-ground experts. So Stephanie, I'll turn it over to you.
Thank you so much, Will. We're really excited to be with you today to talk, I think, really candidly about how you do collaborations in this constantly changing world in healthcare and public health right now. I want to acknowledge that it is through this collaboration that Angie's going to go into detail today that we can see this map. This is Intermountain Health's current footprint. But due to a market shift, we as an organization are actually no longer in that same market. But because of the collaboration and trust we were able to establish, we continue to share best practice and find new ways to do this work, particularly in a world where we are all being asked to do more with less. So just briefly, an orientation to Intermountain Health. We are a large healthcare organization delivery system. We have an affiliated payer. And like many of you, if you'll go back a few slides, thank you to this one, we span 6 different states. And I am sure many of you have a timeline that looks like this. When you look at your organization and how you have evolved over time by prioritizing certain initiatives and products and things like that, we've all seen this and we're all experiencing this within healthcare. If you advance, I want to call your attention to, right, really big market shifts that may have occurred for you and certainly have occurred for Intermountain Health, including the integration with a payer. But call your attention to these dates, right? When we look at the shift within our organization, we are seeing nationally an increase in mergers and acquisitions within certain healthcare markets. And as we respond also to federal policy changes and state policy changes, the growth, right? There are so many more orange boxes near the end of this timeline. Within the past 6 to 7 years, just the growth within any organization has been tremendous. And I will even call your attention again to that blank box, right, where we were part of an organizational acquisition within the Boise, Idaho market that allowed us to participate within this collaboration, and we're no longer in that market just a few years later. And so I want to make space for this reality that so many of us are experiencing. And if you go to the next slide, what does that mean for the work that we are doing within community health and within our organizations? This is a very high-level slide that documents how community health needs assessments occur or community assessments occur. And I think hopefully all of these steps feel very familiar to us. But how do you really create collaboration within this process? What we've learned from lots of national best practices, and then very, very practically in this example that we'll share with you today, is that the first step is actually not featured in this slide. The first step is simply defining your community. Who can you bring to the table? Who within your community maybe hasn't been invited in the past? And then how do you use that to facilitate collaboration? And quite candidly, this is where we found a lot of really practical utilization of the Metopio tool to help us define community, help us really understand what were the health outcomes, very at a high level that we were interested in, and how do we make sure that people from those communities who were experiencing those health outcomes were part of our collaboration moving forward. Metopio has allowed us to really kind of create trust quickly as we do this work. And if you go to the next slide, briefly, we knew as we moved into this market that we Intermountain Health, we were a new player. We were coming in with different resources and different assets, and we really wanted to learn with others. I think there's a certain level of humility that's really essential when you start designing a collaborative needs assessment and recognizing that we all want to have an increased ability to affect change, and we want to increase trust with our community. I think we all want to assume that strength-based assessment approach as we move into our community. And while the benefits are clear, right, you can see here so many benefits to doing collaborative assessments, and based on the poll you shared, a lot of you already engaged in collaborative assessments. We have found that there's really kind of 3 things as we've moved within this market and others, 3 essential things that allow for collaborative assessments to move beyond simply assessment into actually driving action. And the first one is very real, and also this is what part of the most challenging aspect is simply a financial investment. When organizations are able to financially pool our resources and have, again, money in the game, we find that longevity and that commitment to action, of course, increases. The second one I would say is trust. Taking the time to establish trust. This is something that you'll hear Angie speak about is how we did that, but taking the time to establish trust as new organizations or new players or new nonprofits are coming into your market. it really is worth it. And it really does yield the outcomes to bring true change. And the last one is just a lot of transparency and a commitment to action. We know so many of us have been doing this work for so long. And if you're new to this work, you're going to quickly learn if all you do is assess and you don't create that action, communities quickly lose trust, and communities are quick to be vocal about that lack of action. And so being able to do that together and respond together is really essential. So as we've been looking, I've been really grateful in my career to have the opportunity to be part of community health needs assessments since they were required by the Affordable Care Act. So I'm on, I think, my fifth cycle in various roles throughout my organization. But just how do you move to outcome-driven action? And we've seen this evolution of assessments, and we're really seeing an opportunity to move to more community-based empowerment. When a lot of our collaborative assessments started, it was simply consulting, right? Like, hey, local public health department, what metrics are you using? How can we use each other's expertise, from data systems to qualitative resourcing and things like that. And then some transparency and priorities saying, hey, as this organization, we're focusing on this, you're focusing on that. That's great. That's cool. We've seen that really move to more intentional collaboration, right? Doing the work together, co-branding reports, motivated. We were really motivated by reducing duplication of efforts, right? How many community members were saying, please stop asking me what I need, right? Can you do this together? I just did 3 needs assessment surveys, and so I think that really motivated a lot of us to focus on collaboration initially. What we hope to see, right? And I know Metopio has been leading in a number of these conversations. And what we hope to show you today is that this can be done, but evolving to empowerment, really moving towards a space where we can be transparent about our feasibility and implementation, simplify our communication with communities who are overwhelmed. We're all overwhelmed right now, and really focus on evaluation and impact, right? The needs assessments can move us towards action when we do them together. So I'm really grateful for the opportunity now to transition to Angie so she can talk to you about how we did this in a very practical sense.
Thanks, Stephanie. Angie, go for it.
Great. Thanks, Will. And thank you, Stephanie. I appreciate that. And it's good to be here with all of you. As mentioned, my name's Angie Gribble. I work for St. Luke's Health System in Southwest Idaho and Eastern Oregon. And I'm here to represent the Western Idaho Community Health Collaborative, or WICHC, as we call it, which is the collaborative that Stephanie was a part of. That was the anchor and backbone to our 2023 Collaborative Community Health Needs Assessment. So just some background around this collaborative multi-sector public-private partnership. We were established in 2019. If you can pinpoint that on Stephanie's timeline that she shared earlier, that's the point in time that we all came together and said, hey, this work, we've been doing it in our silos and organizationally, historically, we need to do this collaboratively moving forward for lots of good reasons. And it continues to be a good reason, again, as the market shifts happen and have happened over the last 7 years. We have over 16 diverse members that are a part of this, representing health systems, our public health departments, lots of other nonprofits and social services. And really the aim of WICHC is to address those social drivers of health throughout this 10-county footprint within Southwest Idaho. Next slide, please. So our mission as a collaborative, we set this out early, was to transform health of our communities through collaboration, prioritizing. So how do we really look at those needs that are bubbling to the top and make sure we're addressing those that are most challenging for our communities? And then collectively thinking about a prevention approach, a community health approach throughout our region. We really took a collective impact model approach to our work that we did together in order to achieve our mission. And part of the collective impact approach includes having shared data and shared measurement. So that was also part of the catalyst for us to conduct a collaborative community health needs assessment. So all of our member organizations were working from that shared data set and aligning our resources, our initiatives, our funding, and building plans towards those same health goals. Next slide, please, Will. So as I mentioned, in 2023, we conducted our first ever collaborative health needs assessment for this footprint. And to my knowledge, it was the first ever in Idaho that we've actually had this process done collaboratively through multiple partners that we're serving in the same geographic region. You'll see here just a sampling of the partners that were part of this needs assessment. And again, you'll see representation from health systems, including St. Luke's, Intermountain Health, as well as our public health districts. And nonprofits, even higher ed with Boise State University at the table. So, really great to have the diversity of players at the table for this assessment process. Next slide, please. So as I mentioned, this was groundbreaking for our state. It was groundbreaking for our region to actually come together and do this work. To those components that Stephanie mentioned, as far as financial commitment, trust, and transparency, all of those partners that were part of the group, kind of orchestrating, facilitating, design in the seat that relates to financial resources. We had organizations historically, and we were able to just commitments to a collaborative process. We had one of our agencies willing to backbone the agreements for our collaborative and kind of steward the pooled finances for this. So it was great to have them do that and stand up in that place. As far as trust, Idaho is big enough to have some resources and move some work forward, but we're also small enough, we're lucky enough that a lot of us knew each other and had worked alongside each other for multiple years. So a lot of trust had been established from some of these partners originally, but Stephanie and Intermountain, they were new to the market, and there were a couple others that were new. And so being able to build that trust with new partners was really important, making sure that we had opportunities to connect, that we could genuinely listen to each other, hear each other out. Everyone had a say in the process and ability to lean in with their specific subject matter expertise, experience, the conditions that they were coming to the table with, etc. And it was always equally considered as we moved forward. Transparency was also really key. As I mentioned, we had multiple partners that were at the table, and each of us had different compliance components or accreditation components, or maybe other reasons for leaning into the CHNA and being really transparent about our non-negotiables as an organization or things that we needed to have considered was helpful. And we did that early so that we could make sure everybody had what they needed out of this process, and where there were ways for us to give a little, to compromise, or to really build things together, we were able to do that. So we did our best with those three components at the beginning, and I think that was part of what made this a successful work. From our CHNA then, our top priorities that came out were housing, mental behavioral health, and access to care. These are big challenges, big problems, probably not new to any of you on the call. And while they are true and not wrong, naming them at this level, access to care, mental health, housing, can seem really big for collaboratives. They're, again, complex problems, system level challenges, and it can sometimes be paralyzing for partners and collaboratives to say, how do we even address these? How do we move the needles on these things? And historically, maybe within organizations or in collaboratives that were just emerging, the approach to that plan might have been doing things we were comfortable with, that we were familiar with, that were already in our book of business, that we could tag, oh, that's access to care, or oh, yeah, that addresses mental health. But it was really, again, things that we were comfortable, familiar with. Maybe we were thinking more quantity of programming instead of quality of program, and we weren't able to measure our effectiveness and impact, even though on paper we could say we were doing the thing, we were addressing these needs. So that's at the organizational and collaborative level. Similarly, at the community level, these needs can be written so high that they don't see relevancy to themselves. The 10 counties that this collaborative served, we had a lot of rural communities. We had one urban center, but lots of rural communities. And if we were to build a plan to address access to care that wasn't considering the unique experiences and how access to care showed up for our rural communities and our entire region, all of a sudden the work that we do isn't relevant. We lose the trust of the communities that we're trying to serve. They're not empowered, etc. So in order to address this kind of paralyzing partners and collaboratives of how they address these needs meaningfully and to show impact, and how do we empower our communities, we needed rich data. And Metopio was a tool that allowed us to do that. And I'll say in a couple ways. One, in that it gave us really specific data in the Atlas tool and others where we could drive and drill into census tract level data and say, how is this need showing up for communities? How is this how are we experiencing this in all of the communities that we serve? Super helpful. And I'll give an example of that tool specifically in the housing space. The other way that Metopia was able to help us is that because there was so much efficiency on the data sets that are in Metopio, we were able to really design our surveys, our focus groups, and our interviews to be more complementary to the data in Metopio. What do we already know from the data there that we need to flush out a little bit in a conversation? Or what's already existing, and where might there be a gap that we need to know more directly from community voice? So I feel Metopio's, again, efficiencies and comprehensive data that they have available on their platform allowed us to be very intentional and get data on that community voice perspective that helped round out the experience. So again, data available to help us drill down specifically and efficiencies that allowed us to use those other data collection tools more effectively. So the housing, I'm going to give an example in the housing space around how Metopio very specific feasibility of work to do and start to evaluate. Mentioned housing was named as a CHNA need, and we have a housing partner in our community, NeighborWorks Boise. Some of you on the call might be familiar with NeighborWorks. It's a national organization. They provide affordable housing developments, home buyer education, lending, lots of tools in their portfolio to address housing. However, they are not subject matter experts on health. And as they were sitting at tables with other housing partners and their national NeighborWorks organization, they continued to hear this, hey, there's a connection between housing and health. There's some opportunity here to partner with health agencies. There might be some resources here if you as a housing agency partnered with health. So they come back from those conversations. They see housing named on WHC CHNA and say, here's our partner. Let's connect with WHC. Let's connect with them on their plans and actions. We're a subject matter expert in housing. They're a subject matter expert in health. There could be something here that we could find an initiative to do together. So we work together with NeighborWorks, really trying to understand the levers that were making housing pop on our CHNA. That's stability, quality and safety, affordability, and neighborhood conditions. Next slide, please, Will. Quality and safety was the area where we together, WHC and NeighborWorks, were kind of did that feasibility assessment. Where's our alignment with our roles and work as agencies? Where do we have resources? Where are we responding to a community need? Where can we be sustainable? Quality and safety was the lever that we identified. And in particular, NeighborWorks had some resources for home repair programs. Next slide, please. So NeighborWorks used Metopio and the data tools available through WHC to try to nail down where are we going to target these resources we have for home repair programs to help people remain stably housed in quality housing. What you're seeing on the slide here is a visualization, a map created through Metopio at the census tract level for one of our communities in our footprint, Nampa, Idaho, which is a city. This map is comparing just the median year the structures were built. So looking at that age of housing within the Nampa community to say, where is there some pockets of older homes that may be in need for some repairs or some upgrading in order to keep people housed in a quality and safe housing environment. So you can see the highlighted census tract here was one of those that popped for median structure built in our older homes. Next slide, please. Same idea here. Looked at another indicator available in Metopio. Where are there homes that are lacking kitchen facilities? Same census tract highlighted here, same census tract popping as one of those with more homes that were lacking kitchen facilities than the rest of the surrounding census tracts in Nampa. Next slide, please. Here's just another way to kind of visualize that data available in Metopio. So you saw a heat map, if you will, before. This is more a table to be able to compare towards not only, so track 202 was the one we were looking at that was highlighted, not only comparing that lacking kitchen facilities to Nampa, the direct city the census tract is in, but to the county, Canyon County as a whole. You can see a significant difference between that track and again, its city and its county. Next slide, please. Well, last indicator that NeighborWorks and WHC looked at was lacking complete plumbing. So again, a consideration and an indicator of where might there be lack of facilities within the housing that again makes it quality and for people to stay there, age and play safely. Same census tract popping and lacking complete plumbing. Next slide is similar and just another visualization of that data, again, comparing to the city and the county. Last slide I think I have here, Will. So this is just, again, another tool available in Metopio where you can look at some of those indicators side by side, again, census tract compared to the city and the county. And you can see significant differences in the data here that this then informed NeighborWorks and WHC as a whole to say, here's where we're going to target our resources. Here's where we're going to work on improving the quality of housing that we think we can certainly drive impact. We can evaluate our success and would hopefully ultimately see some change on our next CHNA. So really thankful to Metopio, the data that was available and the collaborative approach to not only the assessment, but then driving towards meaningful action and specific action for our communities. That's all I have.
Fantastic. Thank you both. Yeah, fantastic presentation. And we've got a question in the chat on this this is perfectly aligned with what we're talking about, which is around affordable housing organizations and collaborating when it comes to the data collaboration. I think you've talked about here sort of the secondary data and so forth. Are you all looking kind of in the next phase now that you're doing projects together? Are you collaborating on success metrics and outcomes and so forth?
It is kind of the next iteration for us, right? We found a way to implement success and measures, us keeping that pulse on the indicators that we see long term. So definitely in our next book of work that we'll do with NeighborWorks is to define those measures.
Great. And I know we've got time for maybe one or two more questions. Just curious from a funding mechanism on the implementation side. So as you think about those kind of cross collaborations with something like an organization like NeighborWorks, how are you all thinking about the implementation funding side? Because I think people know how to collaborate, pool their resources to do the assessment. I think the implementation side is a little more greenfield in terms of ways to accomplish that.
Stephanie, do you want to go first?
And that's for both of you.
Okay. Sure. I mean, I think this is where we really are seeing collaborations evolve in new ways. And to be candid, I think you have to be really sensitive to the resources within your community that already exist, right? As healthcare, not-for-profit healthcare organizations, right, we have certain laws and regulations that allow us to stay tax compliant. And those laws and regulations allow us to provide grants into the community and different sourcing opportunities that can really focus our efforts and impact and implementation strategies. It allows you to think about health equity in a new way and really engaging our most vulnerable communities and things like that, and making sure that funding is going specifically to there or your. We spend a lot of time and as a children's hospital and safety items like helmets and car seats and things like that, making sure that those are going to the communities that need them most. So I'm not answering directly because it really does matter on your community. And I think just being really intentional and transparent, and it goes back to that trust piece. Can you be transparent with the assets that you can bring to an implementation strategy as an organization? Angie, anything you would add?
Yeah, I think the only thing I'll add is I do think there's value in knowing what problem you're trying to solve, the challenges you're trying to address, and then seeking funding and resources to resource that work as opposed to letting the funding opportunity drive what you do. So I think there have been collaboratives or organizations that, oh my gosh, there's a grant to do this thing. We're going to go do that to get the money to do it. But if that's not really addressing the challenge, so instead kind of flipping it, it's on its script. What does the data say? What is our community asking us to do? What's feasible within our scope? aligned with our mission. Okay, great. Now let's find the resources locally and or other places to be able to meet that challenge instead of letting the funding drive your work.
Great. Well, I appreciate both of you for taking time, but more importantly, for just your dedication and engagement with the community. I think these are fantastic examples about how pooling those resources, collecting data, and then creating accountability through that data collection to really drive change as it comes to life. So thank you both for your work in Idaho and for taking the time to illustrate that work to the group today. As this is a recorded webinar, so we will be sharing that and also sending out some follow-up materials for everybody who participated today. So thank you all for joining. Have a
Thank
great
you.
Thanks,
day.
everyone.